To be a good doctor, I think there are some main ingredients you have to have. A good listener, somebody who doesn't give up, in a sense. Like, again, for me in genetics, there's a lot of times I come across those negative results, and you know there's something. And it's kind of like just keep going, advocate for your patients. I knew I wanted to do medicine pretty early on. People used to tell me that I'm usually good with kids, like I'm like the child whisperer is what they would call me. When my goddaughter was born, we could tell she looked a little different than the rest of the family, and she was not meeting her milestone. I made it my mission almost to figure out what's going on with her. So that's kind of like how I got into not only pediatric, but genetics. Fast forward now, the genetic condition that she has is called Sébalide syndrome. And it was discovered 4 years ago, and there's about 25 to 30 people described in the literature, the medical literature, with her genetic condition. Everything about genetics excites me. One of my biggest moments in genetics was when I actually diagnosed a patient with the same genetic condition as my goddaughter. 20 years ago, the technology was not as great in picking up those genetic conditions or those genetic variations. Now we're able to do exome sequencing and genome sequencing. When I get a new patient, I do a lot of background research as much as possible to kind of like go into the visit with some differential diagnosis in mind. And once I start talking to the family, we gather information from pregnancy, like prenatal history. We talked about the birth history, because there could be some clues that to a parent it may not mean much, but to us it could be more telling. And then depending on the family history, the medical history, and physical exam, then I try to say, okay, what do I think is the best first step for testing? Often I do share the story of my goddaughter with my patients to let them know that I understand what they're going through, but also to tell them that my goddaughter she's thriving, and I know the parents also appreciate that because they love their kids. They want the best for their kids. Being able to help those families, especially providing closures to those families, is very rewarding and very satisfying. I wake up every day knowing that I will be making a difference in a patient's life.